Hi guys, thanks for tuning into my channel, Healthy Back Girl, and my name is Kamala. Yes, that's my real name. Um, this channel is for people that are either you just had an accident or you were born with some kind of issue with your back, and as you get older it kind of starts to show up, or it could just be something that happened while you were working, anything. I'm trying to help people that, were just like me. Um, at one point, you just had extreme back pain and, missing work or not being able to go outside or drive a car. Just things like that happened to me. And I'm just trying to help people to, just fix some of these back issues. Um, so if you're brand new to back pain, or if you've been struggling with back pain, I'm gonna be giving you some tips about how to help you out. So one thing to do is, first, if it's just mild back pain and it's something like sciatica that is just like flaring up every now and then, or it's something more serious like, you know I don't know, like some kind of accident, and now you don't know what happened, the best thing to do is to go see a doctor. you know um, Sometimes people don't like to go to doctors. I like to avoid them as much as I can, but sometimes it's really necessary and you really have to go. You can, schedule an appointment with your regular doctor, and then usually they'll get a referral, and you can go see a specialist to get x-rays, MRIs, whatever it is that they can do to see what's really going on with your back. Um, if it's an emergency and you can't move, you have to go to the emergency room, whether it's an ambulance or somebody can take you there. You need to go get checked out. It doesn't make sense to, just keep going day in, day out, having these pains, not really knowing what the diagnosis is. You don't know what the problem is. You're just assuming maybe it'll go away by itself, and maybe it will, but maybe it won't. And you kind of don't want to keep irritating the same problem. You don't want to, you know, just have your bones just doing things that they really shouldn't be doing. So, number one, you need to get checked out. If you're worried about co-pays and bills, call your insurance, try to find out what it is that you're covered for. Sometimes there's things to work out, but the best thing you can do is do that. You can go online, they have websites, or you can call somebody, at whatever number they have on your card, and they could kind of walk you through or give you an exact list of the kind of doctors that you need. You know, they will actually ask you where you live, and whatever doctor's close to you within a, it could be 10 miles, 20 miles. They'll give you a list. They can email it to you, or if you're just independent, you can do it on your own. You can go online and search for yourself. Just type in the kind of doctor that you need. It'll pop up under your insurance. And I would check out those doctors first. That's the best thing to do, because sometimes you go someplace and they don't really know how to deal with you, or they're just not the nicest people, and they kind of just want to keep collecting payments, and they're not really caring about their patients. You kind of want to call, get a feel of how the office is. Sometimes I call, and if somebody is not picking up, if I call 3 times and I keep going to, messages saying that they're so busy, or, we will contact you within 24 hours. Usually, to me, I don't think that's a good sign. That means you don't have time for me. If you're not picking up when I call the first time or the second time, it's just not a good sign for me. I feel like if I need to see you and I need a service done, then it's really important. I understand there's a lot of patients, and but I want to feel like you're going to take care of me. So that's usually what I do. I look for those signs. Um, so like I said, I call, I listen to see, I check to see how long they take to answer my phone calls. Then when they do finally pick up, um, hopefully it's the first phone call. Um, or if I am put on hold, sometimes they do put you on hold for a little while. That's okay. If I'm on hold for like a minute or two, I don't mind waiting for that. And if somebody comes on and they sound pleasant and they sound professional, they ask you, what do you need done? That's a good sign. Sometimes they're just like, okay, we're booking this appointment. What insurance do you have? Like the first question, what insurance do you have? Sometimes I kind of feel it out to see, where they're going with that. They do want to make sure that they do get paid, and I think they want to make sure that you get covered. So it's not that bad, but it's good when they ask you, what exactly do you need? What service? Yes, I need somebody to look at my back. I don't know what's wrong. And then they'll say, well, which doctor would you like to see? That's another good sign, because they don't want to just schedule you with anybody. What if you prefer female or male? That's a good sign. But most likely when it's new, you won't know who you want to see unless you do your research. Like I said, when I go online, I check to see, where the doctor went to school, if they're a part of some kind of association. you know, I kind of check to see how long they've been working. How long have you been a doctor at this practice? I see where they work, what kind of shifts they have. If I see too many offices and I see like your schedule is just like you're working here, there, everywhere, I'm just, I'm half and half about that. Sometimes it's good because they might be covering your particular area, so that would be good for me. But then sometimes they're just too busy and they're just overbooking everything. So you kind of have to feel that out and check to see, what's going on. The receptionist will tell you if the doctor is, at such and such an office, or if they're at this office. Do you prefer this office or that? So it depends on your preference. Sometimes it does work out in your favor that they're close to you or someplace that you don't mind traveling to. So look out for those things. So when they do ask you about your insurance, obviously you let them know. They'll tell you, or they'll ask you, when would you like to come in? That's another good sign. When I would like to come in, soon as possible. What is the best, what is the quickest time? But it is nice when they ask you, when would you like to come in? What time of day is best for you? Those are good signs that those people, they care. And even if they not that they don't care, but they're just showing a sign that they are concerned. They want to do what is right for you. So those are things that I look for. Let's see what else. The time, as I lead a very busy life. So if they are not open, at after 5, sometimes that's not good for me. If they're not open on a Saturday, sometimes that's not good for me. So it all depends on what is good for you. Let's see what else. I think that's pretty much it. What kind of doctor, a specialist. When you do go online, you can look for specialists. It'll ask you, do you want like a physical therapist, or do you want, a general practitioner? So all those things are available online, or you can call your insurance company. So that's the first part about all of that. And when you finally do go to your visit, before that, let me back up. So after scheduling your appointments, a good thing is when they do remind you of your scheduled visit. That's another good sign. They'll call you maybe right after you schedule the appointment, maybe that same day or the next day. They'll call you to ask you to sign up to their online, profile. Like, I guess you can communicate with the doctor on there, or if they need certain documents, you can go on there and fill out the forms. Those are more like more up to date medical facilities. Some facilities, they don't do that. They'll tell you to download a form, or they'll just tell you, you need to come in earlier to fill out forms. That's fine. I don't mind doing any of that. But it is a good sign when they do right away to show you that we schedule your visit. here, you can go online, you can do all these things to be prepared for your visit so that when you do come in, everything could be faster and smooth. So I like places like that. I look for those kind of things. Um, what else? I prefer, a doctor that, I don't want to be an ageist, but I really don't want to see somebody that's too old, like somebody that's like in their 70s and 80s, because I've had a bad experience with somebody that was older, and I don't want to go there. I think they kind of forgot what it is, the test that they ran for me. This happened years ago, and I'll get into that in another video. But for this, I'll stick with, finding doctors. Somebody that's not too young. I don't want to feel like, do you have enough skills? Did you have enough practice? I don't want those things to go through my mind. Somebody that's like 33, I don't know, I kind of feel a little bit funny about. But, 40s, 50s, I don't mind, maybe late 30s, and somebody that's been working for 10 plus years. I think you've seen enough patients, you've seen enough things, um, you've watched other doctors. I know they do go to their pre-med, and they do everything that they have to do, but you need to have, to me, a minimum 10 years of experience, and you can't be too young, you can't be too old, and a reputable college is something that I look for. um, let's see what else. Yeah, so like I said, when they send you your information to let you know that you can sign up, that's a good sign. And before your appointment, usually the day before or a few days before, they'll remind you of your appointment. They will send you either a text message, or they'll call you and leave a message. Some places don't like to call because, I guess that gets into privacy issues, but, sometimes a good phone call is good. They leave a message and tell you, you have an appointment scheduled for this day at this time. Please call back to confirm that you will be visiting. And the text messages are really good because obviously everybody has their phone. You can look at your phone right away. And you'll see the message. It'll say, press 1 if you are, confirming, or press 2 if you want to cancel, or press yes if you are still, visiting. They have different variations of how they do the text messages to remind you about your appointment. But that's really good. Those are good signs. I had a bad experience with a doctor's office that didn't remind me of my visit, and I really needed to find out what was going on. And I went, and when I went there, they had no idea that I had an appointment, no clue whatsoever. And that's a bad sign. And at that point, I think at a different point, I really did decide that I wasn't going to go back, but I really needed to find out what was going on that day. So I kind of just went anyway. And it was a good thing that I had the actual card that they wrote the my appointment schedule on, the date, the time, and I showed it to them. I said, "Look, boom, somebody wrote on this card that I have an appointment for today." So they both, the two receptionists looked at each other like, oh, like they knew that they were in trouble. So eventually they fixed the issue, and they let me see the doctor for that day. But those are some things to look out for, before you get into a situation, because most likely if you're going through that, that means the doctor behind those people, they really don't care. They're just trying to get their payments, and I don't want somebody. I need somebody that is going to, not to say worry about me, but really genuinely cares to make it a good experience and to make you, heal. Try to get you to be on a good note with, your health. Um, so yes, so that's a great sign when they do call to remind you about your appointment. Um, let's see what else. So yeah, like I said, once they remind you and you get there and you see the receptionist. Another thing, when you get there and you walk in, it's nice when you already know how to get there. Sometimes they'll, try to help you out with how to get there if you didn't, already look it up. But if once you're in there and you're standing at the actual desk and somebody right away tells you, I'll be with you, that's a great sign. I'll be right with you. If they're on the phone, they'll make eye contact, they communicate with you to let you know that they understand that you're there, you have an appointment, and they'll be right with you. Oh, so many bad experiences. This is why I'm trying to help you guys out. I've had experiences just standing at a desk, no one else in the whole place, and you're just standing there, and they're just acting like you're not there. They're going about their work, head down, filling out paperwork, and you're just standing there wondering, do I say something? Is this person gonna say something? Do they even know that I'm standing here? But then you're like, well, I'm the only person standing here, so they do know I'm standing there. They look up, so those are all the things that I kind of look out for. And um, obviously once you're in the office and you see something like that, you already have your appointment. At that point, it's kind of, not to say it's too late, but you don't want to just cancel right there while you're in the appointment. You kind of want to make the best of it. So yeah, so hopefully you don't go through those kind of things. So you kind of like feeling all of that out on the phone. Yeah, so best thing, once they see you, they ask you for your insurance card, your ID, you sign in. Sometimes they do have a sign-in card, a sign-in sheet, name, time. And it's best when you do come into the office and you don't see a whole row of people sitting there just waiting. That's not a good sign, because like I said, that's like, it's just trying to get paid. It's like a revolving door of people. But when you see, like 3 or 4 or 5 people there, that's not bad when they have different doctors, because obviously they're probably patients for different doctors, not just one doctor, which means you'll be seen either at your appointment time or a few minutes after that. So those are good things, when you're only there for like 10-15 minutes and a doctor right away calls you. They're like, come in. Or if you did have paperwork to fill out, you fill out your paperwork, and once you're done, you're only waiting for like another 15 minutes the most, not for like an hour. I've done that before, never doing that again. Or 2 hours not seeing a doctor, never doing that again. So 15 minutes tops. If you're not filling out paperwork, that's a good sign. So obviously the nurse will come out and call you. That's a good sign. They physically walk out to the room and they call you, not like way back in a room somewhere. I've had that happen to me before, and just sitting there wondering, do they still know that I'm here? So that's another good sign.